everyone. Thank you again for coming tonight. Thank you to our wonderful volunteers who have come to share their stories, because it is sometimes hard to get up in front of a group of people and talk about your personal experiences. I'm going to talk about hearing aids and tinnitus today, and Dr. Bauer kind of got us started already talking about the brain and how the brain hears, and she talked a little bit about how tinnitus kind of starts from a lack of sound. And as audiologists, we see this on a regular basis. We refer to it as auditory deprivation. Over time, having hearing loss over many years, the auditory centers of the brain become deprived. It's just like putting an arm in a cast and not using it for 6 weeks. When that cast comes off, the arm looks all wimpy and the muscles are all weak. Well, when we don't use our brain in certain centers of our brain, they get weak and they aren't as good at doing what they need to do. So when hearing loss is present, sound cannot be detected by the brain. The sound isn't getting through because of the broken inner ear. So if the brain can't hear it, the brain can't process it. If those sounds are missing, you can't perceive that they were there. And so there's a void created. So when you have normal hearing, all the sounds of speech are detected. We have high frequency speech sounds like F and th and S, all up in those upper ranges, and then we have vowel sounds and some of our different consonants down in these low frequency ranges. When we have normal hearing, we can hear all those sounds pretty well, especially if it's quiet. Now, if there's a little background noise, people with normal hearing might miss a few sounds here and there, but for the most part, it doesn't affect us very much. Now, we add hearing loss, and we're going to take away all this area in yellow. So imagine if you can't hear all those red consonant sounds that are falling into that yellow range, and you're only hearing what's over here. All of a sudden, the clarity of speech is gone. You can hear that people are talking. You can hear they're saying something to you, but they're mumbling. If they would just speak more clearly, I could understand them. Who's said that before? If you just enunciate. Well, it has I won't say it doesn't ever have anything to do with the speaker, but oftentimes it has to do with the fact that those sounds in the yellow are not even making it to the brain. And if the brain can't hear it, the brain can't process it, okay? So what do hearing aids do? Why is it so important that we talk about hearing aids with relation to tinnitus? The goal of hearing aids is to improve access to sound. Having a hearing aid doesn't change the fact that you have hearing loss. You will always have hearing loss, but a hearing aid improves your access to that sound. Are the sounds in our environment reaching the ear? Are they reaching the brain? So we talk often about two types of signal processing. The first one is detection. Can you hear it or not? So if I were to play a beep, like beep, 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 and if I said, when you hear me beep, raise your hand, beep, 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 that's detection. You heard me or you didn't hear me. Signal perception has to do with how the signal is processed by the brain. So there's a little bit more decision making going in there. That's like if I asked you if I said the word box or fox. You're having to make a decision about what you heard. Not whether it's there or not, but actually processing the information. So hearing aids make sounds louder so they can be detected and processed. But we rely on our brain to do that processing. Just like the brain generates the tinnitus because of its lack of stimulation, we want to use hearing aids to increase that stimulation and help to decrease the tinnitus. There are some myths when it comes to tinnitus and hearing aids. The first one I think Dr. Bauer kind of alluded to, that tinnitus is causing my hearing loss. I have had some insistent patients that if I could just stop that tinnitus, they could hear just fine. And like Dr. Bauer said, most people with tinnitus have hearing loss. So even if we take the tinnitus away with some magic button, you will still have hearing loss. The second one is hearing aids will make my tinnitus worse. This is very unlikely. There are very, very few people that adding sound makes their tinnitus worse. Very few. And for those few that it does happen with, that's why we have Dr. Bauer and Dr. Parrish who work with tinnitus patients. They can recognize that right away, and there are special therapies we use with those people. But generally speaking, wearing hearing aids does not hurt your hearing, and it doesn't make your tinnitus worse. And a lot of people feel there's nothing that can be done for their tinnitus. Well, that's why you're here today, because we're going to talk about things that can be done to help. And a lot of people think because they have tinnitus, they don't have a hearing problem. That kind of goes back to the tinnitus is causing my hearing loss. But a lot of people really feel they hear fine, no loss, just that tinnitus. But chances are there's some hearing loss somewhere. All right, so I want to give you a little history and background, and I did some research on my own looking at what research has been done over the years. So hearing aids have been used for tinnitus treatment for over 60 years. This is not a new concept. 70 to 85% of people with hearing loss have tinnitus. And hearing loss and tinnitus have the same negative effects on our lifestyles that increases our stress, causes difficulty concentrating. There are social and emotional difficulties, as we heard from our guest speaker about how she kind of withdrew from her friends and just wasn't involved. That isolation can be really tough. And of course, fear it's going to get worse, fear that there's no treatment, and the fear that there might be something really wrong with you. Again, as we learned from Dr. Bauer, that's not generally the case. So here are some research findings I found. A very large study, over 2,000 people between 1980 and 2004 were reviewed in retrospect. 69% of the patients showed improvement in their tinnitus following a hearing aid fitting. In another study in 2006, 28 out of 33 patients reported significant reduction in their tinnitus after hearing aid fitting. And that study also found that if someone has hearing loss in both ears, they need a hearing aid in both ears. We need to treat the whole person, not just half of it. Couple more. Hearing aids, when coupled with counseling, is more effective than counseling alone. And Dr. Parrish is going to come up here shortly and talk more about our tinnitus management program as far as therapy and counseling. But we know from this study that the outcomes are better if we couple hearing aids with counseling and not just counseling alone. And finally, a study in 2009 showed that just regular hearing aids that we sell today to people with hearing loss and no tinnitus are effective at reducing tinnitus. You don't need a high bandwidth special hearing aid, and it was definitely better than no hearing aid at all. So that was just some information I found reviewing the literature. So hearing aids can help. They help in different ways. They can act as maskers. A masker is something that helps cover the tinnitus. And they do this because they're amplifying sound that we can't hear, sound in our environment. And by bringing more outside sound in, we are less aware of our tinnitus We're making more information available to our brain, and that brain becomes happier and it stops trying to listen so hard. It also, hearing aids also facilitate better communication. There's a lot of stress involved with trying to communicate with hearing loss. There's a lot of fatigue, and we know that stress and fatigue can make tinnitus worse. So by reducing that straining to hear effect, we can help with tinnitus as well. And hearing aids can actually work directly against the tinnitus generation sites in the brain. It reduces, remember Dr. Bauer said, the brain is actually kind of turning up the inside volume, turning it up. By giving that sound back, the brain can start to turn down that inside gain, that inside volume, so tinnitus becomes less. So briefly, I just want to go over some options and why we choose these for treatment for tinnitus. The first is a standard digital hearing aid. We generally like to fit these as an open fit hearing aid for people with tinnitus because we want to leave the ear canal unoccluded, open. That makes your own voice seem more natural, and the device is generally more comfortable on the ear and in the ear, so it doesn't create an added stressor or distraction. These types of hearing aids are only worn during waking hours, so only while you're awake, and you don't typically wear them to bed, and you cannot get them wet. So you can't wear them in the shower or swimming or anything like that. And some people choose not to wear them while exercising just because of getting really sweaty. But we also have some standard digital hearing aids that are available as a combination device. A combination device is a hearing aid that also produces a little noise or a little static noise that we refer to as a masker. So it's an extra signal that's being laid over the amplification of the outside noises to give the person just another tool in dealing with their tinnitus. And there's a couple of different companies that carry those combination devices, but they look just like a hearing aid. There's one other type of hearing aid called the Lyric, and it is an extended wear hearing aid. This device is worn 24 hours a day. You wear it to bed. And the benefit of that is it allows us to stimulate the auditory system constantly. So how many of you notice your tinnitus most when you lay down to go to bed at night and it's all nice and quiet? We got a few hands. So the Lyric would be in your ear and still amplifying environmental noise and would help serve as a masker. You can wear it for bathing, swimming, exercise, sleeping. You wear it for a couple months before the battery goes dead, and then you have that one taken out and a new one put in. So the only thing that's different on this one is you cannot get a combination device with this type of instrument. But for the right person, either one of these options is appropriate. It just depends a little bit on your lifestyle, your wants, your needs, where are you most bothered by your tinnitus. All right, and that's all I have.